Thank you so much for those wonderful sessions. Dr. Nittaya, do you agree that these conversations are really, really great to hear?
Exactly.
Yeah, and I am me myself, even though I'm already exposed in the HIV work for so long, I'm still learning a lot of new insights. For everything that we have heard in the first session, and also looking at how you facilitated in the second session, there's so many insights that you want to hear. And I think let's proceed to the last session where we would translate all of these insights that we collected from the first and the second session, collect those insights, and let's discuss how can we make stigma-free communications a reality. And with that, I would invite all of the panelists who participated today in the first and in the second session so that we can discuss how we'll be able to realize everything that we have discussed today, and how can we change the way we work, the way we act, and the way, how can we change the world for the better. So I invite them all to be here today. There. Again, thank you all so much for all of your insights that you've shared. For those, for everyone who joined me in the first session where we discussed how can we improve our communications in our healthcare perspectives, and of course for those who joined Dr. Nittaya in their second session, the community representatives on how can we voice out our concerns and improve, tell everyone that we deserve safe services for all of us. So I think I would start the conversation by asking all of the panelists, and I know we are such a large group, but I think I can do it, Dr. Nittaya, from my part, from the part of my session, and you facilitate it from your session.
Sure.
Yeah, but I think everyone in the panel to answer this question. After hearing from all of the panelists and all of the speakers that we, that shared their insights today, what is that one thing that you think that you will do after the forum, or that one thing that you will stop doing, so that we will be achieving a stigma-free society, or a stigma-free in terms of our in our line of work? So I'll start first with Stephane.
Sure. I think from doctor point of view, and also from the community or clients point of view, one thing I should really admit is like everybody errs. We make mistakes, and it's sometimes stigmatization is not really it's from a fixed ideation, and sometimes you just you don't have the awareness that you're making such stigmatizing comments. So one thing is that to be sensitive about all different cultures, and another thing is I think it's important, like Jemma says, it's not shameful to apologize if you make mistakes, because we just want to keep this communication going. So if you are having something that you're not sure of, or you're really, really unfortunately made mistakes, just tell this to your clients, I'm sorry, and maybe you can explain more to me what I have done. And yeah, I think it's a great thing for both clients and also for doctors.
Thank you so much, Stephane, for sharing to us. Every day that we do in our field of work, it's always a learning process for us, and we are not perfect, and it's very important to recognize that fact, or be aware of that fact, and just be apologetic, that we can always learn for the best. Thank you so much for your insight. For your insights, please, Dr. Iskandar.
Iskandar, I hope you are not going to remove some of your colleagues from your hospital. Huh? You seem couldn't be unmuted, right?
Sorry, I was just trying to find the mute button. No, but I'm glad that you probably repeated it. I think it's as I probably just reiterate because it was brought up again, was that I think it's a reminder that as doctors and we go into medicine to be honorable and to serve patients, and by engaging in whether conscious or subconscious stigmatizing behavior, we work against what we originally go into medicine for, and it's against our Hippocratic oath. And if we're doing something against our Hippocratic oath, then we should be called out and told that we're not doing something right. And if that means removing that person from medicine because they're not keeping to their Hippocratic oath, then that would be, I would encourage that, without a second's doubt. Now, coming back to the do's and don'ts, I think what I've been hearing, particularly in this forum, is repeatedly patient-centered care and holistic care to the patient. So that's been brought up repeatedly. And just to reiterate that can only be the right kind of care to be given to patients. I'm learning a lot of use of correct pronouns and terms, and be humble enough maybe to ask the clients and patients in front of us, for example, some tips which was given by Jen as well, in terms of addressing questions like, if we don't know, then let's ask them, what would you like, how would you like to be addressed? So using correct terminology and treating the patient like a patient and not the disease that they have is so important. I think stigma is a never-ending conversation. And I think it's something that we can just continue to talk about it, but we really need to think about in introducing effective stigma reducing interventions within healthcare settings that work. So this is the bit where implementation science comes in. I think it needs to be top heavy. I think we need to not just work with our hospital directors and realize that this is a problem within our setting, but also go beyond that. And once again, just to reiterate that it is so important to include this in the medical curriculum and to have visibility and representation of the voices of people living with HIV and key populations in the undergraduate curriculum. We have found that since we've introduced this to students, to medical students, it has been the favorite topic. It's more effective and has more impact than if you were to give it in a lecture. So just like everything we do in HIV medicine, the voices of those who are affected by this make the most impact. So those are some of the things I'm hearing.
Thank you so much, Dr. Iskandar. It's really, I think one lesson that we really had in this forum is to go towards patient care approach, because I think that's the only, as you said, it's the only approach that's very ideal for us moving forward, putting clients and our patients first. Thank you very much for that. Your insights, please, Butch.
Thank you. Though stigma and discrimination may be different in meaning altogether, they go hand in hand. And I believe that change comes from within. In as much as we would like to change the mindset of everyone, it has to be from an individual themselves. So be the ripple of change that you want to create. And at the end of the day, if, in Ellen DeGeneres' famous words, be kind to one another because kindness begets kindness. And if we just become kind to one another, I think we will all live in a better place. Thank you.
Thank you very much for that, Butch. I strongly agree. If we are just all being kind to one another, stigma would really be, eliminated in this world. But we are still far from there. That's why, that's why forums like this are very, very relevant to us. And this is, as Dr. Iskandar mentioned, this is a never-ending conversation. Thank you for that, Butch. Isaac, your thoughts, please.
Thank you so much. Yeah, this is a great, wonderful, insightful forum I have, and really learn a lot. I think the key things I would like to say again is, I think here we are including all the panelists and the audience. I think every of us, we are influencer in this digital world. we are kind of like network of us as either community or provider, or if you are both, or maybe you are sitting in a medical curriculum panel, you are sitting at a school, institution, your medical society, because stigma is so multifaceted and multi-level. We need to kind of connect it with all kind of different level. For example, what about decriminalizing people living with HIV about their sexual act in your country? How can we slightly, like push the agenda a little bit to the front by collaborating with other sectors, legal sectors, healthcare sectors, community sectors, and our medical societies, as it is very important, and how we can utilize our resource at either we are junior doctors, or senior ones, we can just collaborate with each other with different specialties outside HIV specialists, outside sexual health physicians. It's not really useful to demonize or attack people who had misconduct if we don't listen to what happened to them. It happens to both patients, clients, and physicians and healthcare workers. I think it's always good to say, I know we may do something wrong, but ask your colleague what happened and what do you think, and can we improve the situation by conversation, so that we can really form like a community and to fight the multi-level stigma. Thank you.
Thank you so much for that, Isaac. And it's really, really important to start conversations and making ourselves understand where they're coming from. Even though that, they might place judgment to other people, let's ask them, where are they coming from, so that we will be able to understand and provide that learning that they need, so that they will be able to respond better to the community. Thank you so much for that insight. How about for your side, Dr.
Thank
Nittaya?
you, Tendrick, and thank you, the first co-panelist. I really believe that the power is in our hands, Tendrick, as you just wrote in the our forward for this year forum, and that I also believe that the power in our hands will start this ripple effect. I'm very much agree with what Butch mentioned a few times already. So for our part here, I may want to start with Thomas first, and then do the the other way around of addressing the last question from Danvik, please.
Yes. As a person living with HIV for more than 20 years, and actually my experience tells that stigma discrimination, it comes from both external and internal. And I remember back to about 10, 20 years ago, I'm worried about the other people knowing my status. And I try to hide myself, right? But as step by step, I'm getting more confidence. And I think, so that's why nowadays I have colleagues working with me. The internet is so easy to find out who is who. They Google my name and they find out who am I. Okay, so, but the point is that they see me as normal until one day, now I'm in Cambodia, and one of my colleagues suddenly one day tell me that, Thomas, I think you need to pill your medication next week. I say, how do you know that? He said, we noticed 3 years ago. And actually, they always know who am I and what kind of medication I'm taking. And then they just pretending don't know. So make me very warm and helpful. So in our medical settings, I think, so now we are running a HIV clinic along with the government. And what we did differently now, I think we're taking action, is we're recruiting 2 professional psychologists. And they are going to helping the behavior change communication with the medical doctors. And also they provide professional skill to our peer counselors, make their work better. And I think sometimes when we heard about the stigma discrimination, and maybe for the same behavior, the reaction from the patient, the client, is different because they feel they've self-stigmatized, and then they become oversensitive. So, and then I think some concrete action we need to taking is integrating mental health service to this HIV service together. That's what I'm doing now, and it's the beginning. And we're trying to find out that there must be a model to be able to better making the physician, they proud of their work, and the clients, they feel the clinic or hospital is friendly, and then they love to be there. And also when they walk out of the clinic, they back home, they feel better and feel confidence as well. I think that we need to treating the internal issue as well. Thank you.
Wonderful, Thomas. You brought up this mental health issue again, and I believe that this will be something of the focus for next year. This year APAC, as well as like next year, probably our forum next year as well. So we'll make sure to note that. So now let's come to Jemma, please.
Thank you, Dr. Nittaya. I would say practice makes perfect. So you have to keep practicing. And I have 2 tips here. Be mindful, be mindful. Normally the stigma and discrimination are the negative thoughts that come into your mind. So try to be mindful and catch that moment when the negative thoughts coming in your mind, and try to filter it out and communicate positively. And that's one first tip. And then you keep practicing on that. And then the other thing is that what you can do right now is that I heard lots of things that people share today. You can put them together, like into this kind of, not sure you can say, it's like, this is what we put together at our clinic, the scenarios of what the do's and what the don'ts that we actually face them, or we actually heard from the community, and you can share this to your colleagues. So to prevent this to happen at your healthcare setting. Thank you. That's for me.
Thank you, Jemma. So be mindful, and then have these do's and don'ts, practical tools for healthcare providers. Thank you very much. Now let's come toพี่สุรางค์ค่ะ.
I would like to say that stigma and discrimination is around us. We have to start from ourselves, and also we have to respect with each other. And every day that we have to do is very carefully that to make sure that we not stigmatize others. And we have to believe that we can do. Thank you.
Thank you very much. Yes, we can certainly do it. Everyone can certainly do it, right? So let's make sure that people realize their potential in addressing stigma discrimination in your own ways. Thank you very much,พี่สุรางค์. And now our last panelist to address this question, Jan, please.
It's really just to learn to get out of our own ways as much as possible, not just as a clinician or human rights advocate, or even a very, very, very gay Catholic. Really, one of the key teachings when we talk about compassionate work, of which medicine is one of the most compassionate, or should be anyway, is to get out of our own ways. Prejudice happens when we allow our own anxieties to get ahead of ourselves. Fear happens when we allow our anxieties to get ahead of ourselves. So, and this happens both ways. For the people who come in, they come from a place of pain. I mean, that much is obvious to everybody. But at the same time, other people also come from a place of pain and a place of doubt. No? And if we all just learn to try and give everybody the benefit of the doubt, no? Again, not to assume anything, right? Do not assume safety. Do not assume compassion. Be active about it. Ask questions. And for the love of God, we're human beings. We have to give ourselves a break every once in a while, right? And you know, in our clinical work, it's really that. That's really one of the best things that we can provide. No? Is that space to make mistakes, right? It's that space where you don't have to be perfect. And even if you're not perfect, you can absolutely get the work done. You can absolutely get the treatment going. You can absolutely get whatever it is you need to get going, right? You don't have to be perfect. You don't have to be so afraid. So, yun, just get out of your own way. Get the prejudices out of the way for a little while, so that the human being behind that comes front and center. And I thank you.
Thank you, Jen. I think that's a great way to end this discussion. Don't assume, be active, and we will. We are all human beings, and we love mistakes. We learn from mistake, and we will do better next time, for sure. So with this, I will then hand this over back to Danvik for the closure